Hello, I'm Dr. Fernara with Phoenix Mobile Veterinarians, and today I'm here to talk to you about why cat spaying and neutering is such an important topic. With my assistant Rebecca, we are here to answer questions you may have regarding this subject.
Dr. Fernar, what is cat neutering?
Cat neutering is used to describe when we remove the testicles from male cats.
What is spaying a cat?
Spaying a cat is when we remove the ovaries and uterus from a female.
How does spaying or neutering impact the health and well-being of my cat?
There are certain infections that we can see in intact cats, certain cancers that can form with time with intact cats, and different undesirable behaviors that cats can develop when they're intact. So spaying and neutering will help prevent a lot of these unwanted behaviors, infections, and certain cancers.
How soon should I bring my cat in to see a veterinarian to get them spayed or neutered?
We always recommend for kittens spaying and neutering around 6 months of age. We do start to see certain behavioral changes that are associated with intact kittens. Between 7-8 months of age, these spraying, marking their territory, possible aggression. So we always want to try to get them in for an exam and talk about spaying and neutering prior to that. If you have an adult cat that you've recently acquired or adopted, we recommend spaying and neutering as soon as you can. So scheduling an appointment with your veterinarian right away is beneficial.
What are the medical benefits of spaying and neutering cats?
So similar to what I talked about before, the main thing that we see first off are the undesirable behavioral side effects. So intact females will howl a lot during heat cycles. There can be spraying or marking behaviors where cats will go outside the litter box to mark their territory. Aggression can be associated with intact animals as well. And then, of course, we have the potential for certain types of infectious processes that can develop from being intact in males and females, along with different types of cancers. So testicular cancer for male cats, uterine cancer, mammary gland tumors for female cats.
How will spaying or neutering affect my cat's behavior?
Spaying and neutering shouldn't affect your cat's behavior very much. Again, if there are some aggression issues or unwanted marking, howling, behavioral issues like that, a lot of times spaying and neutering can completely make these symptoms go away. So either decrease them significantly or stop them altogether. We're not looking to change those lovable characteristics of your cat or behaviors, and it really doesn't do that. Overall, it just helps with their health and well-being long term.
How should I care for my cat before and after spaying or neutering surgery?
Before surgery, it's going to be based off of your veterinarian and what they recommend leading up to the surgical procedure. Most of the time, we recommend continuing on as you would. It's feeding the cat, taking care of the cat like normal. Post-op recovery usually lasts for about 14 days after their procedure. And during this time, you just want to make sure they can't get to their incision, lick it, make sure they're staying clean and dry, not getting into any water, and they're in a space, more of a confined space that you can monitor them as their incision heals. And then there can be medications that are recommended in post-op recovery as well. But other than that, really they can live the life that they have been living in your home. If you have any other questions regarding cat spays and neuters, please give us a call at Phoenix Mobile Veterinarians.